Today on Soma Says, we're joined by Dr. Hisham Seify, a board-certified plastic surgeon with more than 2 decades of surgical expertise and national recognition in aesthetic medicine. Based in Newport Beach, Dr. Seify is known for his work in facial aesthetics, breast surgery, and the evolving intersection between cosmetic procedures, longevity, and integrative health. In a world where midlife women are navigating hormonal shifts, body changes, weight loss medications, and a culture heavily influenced by social media, Dr. Seify brings clarity to what modern plastic surgery really looks like, including emerging therapies like exosomes, regenerative techniques, and how aesthetic medicine fits into overall wellness. Dr. Seify, welcome to Soma Says.
You've spent more than two decades, right, in plastic and aesthetic surgery. How has your philosophy of beauty and aging evolved over time, especially as your patients age with you?
I think everyone now is more concerned with more natural beauty. When I started practice 20 years ago, everything was bigger. So wanted to have bigger breasts, bigger body parts, things like that. I think now we're getting back to more, how can we be more natural and still youthful? I think the second portion is also now, even plastic surgeons are involved in, although we can make you look younger, we also want you to be healthier, because I think they both go hand in hand. So it's not just that my facelift patient would look younger, but I want them also to be actually youthful and to do that. So we've been adding some integrative things into our protocols as well to maximize healing, but also to make them healthier as in general as a person.
From your perspective, what are the most common physical changes that women notice in their 40s and 50s, let's say in their face, their breasts, their general body, especially around menopause?
Great question. So it follows basically the lifestyle, and it also follows having kids, getting married, how many deliveries, and so forth. But let's say the normal family, marriage and kids is usually in the 30s, sometimes 20s, but most people are around their 30s, early 30s to late 30s. And then they finish by late 30s. Now they have excess skin into the abdominal area. They nursed, so now the breast gets a little bit saggy. And then now they get into the mommy makeover stage, which is trying to address the body and breast changes. And that's usually 30s, 40s, 50s. I have seen people coming in their 60s and 70s to do it, and I always ask them, why did you wait? And people are just busy, and things happen in life, and they cannot do it when they want to do it. Face is a little bit different. Face can come a little bit later than that, which is, I would say, 40s, 50s, 60s, 70s, 80s. 40s, we try to go non-surgical as much as possible. One of the early signs are usually eyes and neck.
Okay.
So when people come in and says, look at my eyes, I'm starting to look a little bit tired, then we give them the options. We can do some Botox, we can do some fillers, we could do some lasers, or this is a little bit too much skin excess, I think we should go to surgery, and that will give you the best outcome. And then when they go to the stage of 50s and 60s, a lot of it becomes more surgical towards a neck lift, a facelift, a forehead lift, things like that.
How much of what aging is within our bodies is actually driven by the hormonal shifts, by inflammation, muscle loss, or is it just pure aging?
I think it's a combination. For skin, obviously, sun damage is definitely a big factor. I think aging itself, different type of ethnicities. We see some patients in their 70s and they look their 50s. And I see some patients in their 40s and they look their 80s. So a lot of what we do to ourselves, smoking is a big problem. Smokers obviously usually don't age very well. Excessive alcohol is also usually a problem. A sedentary lifestyle, not exercising, a diet that is not appropriate, stress, right? Me and you know that.
Yes.
So that affects our life as well, make us look different. But again, I have patients in their 80s and I sit down with them and I talk to them and they look great. And I say, what did you guys do? Tell me, now you're going to teach me what to do. Because they just had a good life. They had a good life. They didn't smoke. They were careful with sun damage. They had a stable family life or some friends around. And these blue zone concepts now is all based upon social activity and how much support we have. So it's a combination of things.
Do you think it's also a genetic component? Are some people just genetically advantaged when it comes to their skin, perhaps their bone and muscles, and that helps with the aging process?
100%. Yeah.
Okay.
Definitely, some people, they look amazing in their 70s just because genetically. And they come and tell you, my mom is 90 and she looks great. And then when the mom comes with them, is wow, I can see you're going to age gracefully. So definitely genetics makes a huge difference.
And how do you help patients? You were talking about natural aging. How do you help patients define their version of natural aging? How do you guide them with that?
Best thing is I always, if someone comes in for facial rejuvenation, I ask them to bring a picture, them in their 20s or 30s. And I tell them, first rule of plastic surgery, we're not trying to make you look like someone else. That's number one. Number two, we're not trying to make you look a strange look. I don't want you to look like a cat or something different. I just, I want you to look you in your 30s and 40s. And I think if you take 1 to 2 decades of life back, I think that's a good outcome as long as it looks natural. So my patients, they come after surgery and says, my friend saw me and they felt like I'm refreshed. So what did you do? You did something, right? It looks pretty good. You don't want the picture that says, oh my God, you did a facelift. You don't want that. You don't want that extreme look, extremely pulled, something like that. So the more natural, the better, in my mind.
And previously you were mentioning, and I think this is what you were touching on, regenerative aesthetics. And I'm starting to see some of it in certain hair products, serums, and things like that, exosomes. Can you explain to us what that is? And then a lot of my patients are also interested in stem cell supported procedures. Can you explain what the science is behind that, or do you think it's all hype?
I think there's a role for it, for biological things to be done. You mentioned exosome. So exosome is a messenger RNA, and it basically, you use it to help going to the cells and help producing certain proteins. In America now, by FDA approval, you can only use it locally. And we use it in this practice locally per FDA regulations for skin rejuvenation and for hair restoration.
Okay.
Even our patients, when they have a hair transplantation, we still put them on some exosomes to be able to do it. You can combine it with lasers, which creates microchannels. The exosomes go through the microchannels. So I think it's a good addition to have. Other biostimulants could be also a good thing for rejuvenating the skin. Lasers are always a good idea. We tell our patients, when you do a facelift, we do recommend you to come every year to have a small laser treatment.
Okay.
And I think, and they asked me why, and I said, because next year, me and you will be 1 year older, unfortunately.
Right.
Aging doesn't stop. You want to do that. So I think if you combine this, one of my partners in the practice is an integrative medicine expert as well. So I get them to have a conversation with her and how they measure the hormones. They check all these deficiencies. They make sure everything is well balanced. And it's a holistic look into aesthetic surgery and not just surgery by itself.
I'm going to shift into breast health. And so breast changes during perimenopause and menopause are a major concern for women. How do these shifts affect the breast tissue, and what surgical options make sense for these types of patients?
So the changes in breast is usually increasing the amount of fat, decreasing the amount of glands, especially in the times where the breast is not used as an organ. Obviously, from a physical standpoint, it usually means most of the time it's sagging breast tissue, which a lot of times require lifting. Some patients end up losing volume of breast, which then requires some sort of an augmentation, either with their own fat or with an implant. Implant is obviously more defined because if you put 300 cc implant, you're going to keep 300 cc. Fat, you put 300 cc's, you're going to probably keep 200 at the end of the day. But it's advantageous because it's your own tissues as well. And some people come to us because of that. There is the opposite also. The opposite, which is people with very large breasts. And then they come back in their 50s and 60s and says, it's starting to hurt my neck. And then they need to have a breast reduction at that time. So the scope of breast is very interesting. And then we also have the breast cancer, which is a totally different topic. And I still do some breast cancer. I'm very proud of that. Because I think we offer a great service by doing the best reconstruction possible for these patients.
Okay. Does your practice also engage in weight loss in terms of the GLP-1s and helping patients lose weight? Do you do that yourself, or do you have anybody in your practice who does that?
So I learned from one of my patients where she came for a mommy makeover, and I told her, you need to lose about 15, 20 pounds. So she looked at me and said, Dr. Seify, do you think I would have lost it on my own? That's why I'm here. And I said, yeah, you're right. So we did start a GLP-1 clinic in our office maybe a year and a half ago. And my partner also helped with this. And we screen them well. We do the right labs and we put them on small doses. And been a great addition because first, they do lose the weight. Number two, they are focused in one place. And then after they finish, then becomes the time for surgery if they need to do the surgery.
And these types of medications, I'm referring to Wegovy, Zepbound, or the equivalent semaglutide, tirzepatide. How do you see these reshaping the types of patients that you see and the types of conversations in terms of surgery that you're having? Because patients lose weight, right? And there can be changes in skin, muscle, obviously metabolic health. What kind of conversations are you having with these types of patients?
It is extremely positive for sure, because at the end of the day, the more you lose weight, the more in general you're going to be healthier. Now, we understand now that some of that weight loss is not just fat, and some of it could be skeletal muscles and so forth. But at the end of the day, it will get them where they need to be. Because the biggest challenge 20 years ago was someone coming and wanting to do a tummy tuck, for example, or mommy makeover. But the truth is, they're not good candidates because they are 40 pounds overweight. And it was hard at that time. To lose 40 pounds by dieting and exercising is not that easy. You have to be really motivated. If you're busy with your life, that's tough. Now, of course, there was gastric stapling, all this, but then it comes with its own issues. Having that simple medication that you can take once a week, and then you're going to drop 22 pounds, 30 pounds, 40 pounds, is just incredible. And I think it's, as you've seen probably with your guest and yourself, is that a lot of people are using it more and more. A lot of articles out there. It will increase the amount of plastic surgery done, for sure, because there's more patients now who are having excess tissues, which will require surgery. So I think so far it's positive. I don't think we don't have very long-term data on what's going to happen in 30 years or 40 years with these medications, but so far, seems like the safety profile is pretty good.
Yeah, I agree with you. And in terms of what I've seen, the cardiovascular benefits, renal benefits, obviously the benefits on your blood sugar, and even your overall metabolic profile when it comes to your cholesterol, it's been phenomenal. I've been working with these types of medications for years. And when they first came out 20 years ago, that's when I wasn't so thrilled about it because they had much more side effects associated with it than they do now. But I think it's been a game changer. And I do hope that the safety profile continues, and I hope the longitudinal studies show that they remain beneficial. And you were touching upon women and surgery after weight loss. How should women think about timing their surgery after weight loss to protect their long-term outcomes?
So we like to have some stability on the weight loss. So first of all, determine the goal. How many pounds you need to lose, 20, 40, 60, whatever. And then once they get to that weight, we want them to be stable on it for some time before doing anything. And then obviously it comes with the whole medical profile. So some people are diabetic, some people might have heart issues. And as universally, with weight loss, this improves. I had patients who stopped metformin, right? We had patients who are no longer on blood pressure medicine. So you just tweak it to the right timing and to the needs of the patient, their social life, their schedule, kids, all these things.
You were mentioning something about a cat, right? And I imagine maybe someone came into your practice wanting to look like a cat. Is that a real thing?
There's a term now, and you can find it on social media, about cat eyes. And the idea of cat eyes it's a certain way of lifting the eyes. And some model have that naturally because that's their genetics and they look pretty good. And in some patient, it might look good, right? But I always joke with my patient, and I'm just trying to tell them, I want you to be as natural as possible. So I always joke and say, we're not trying to look like a cat. And it's a trick question, right? Because then it opens up what's on their mind. I do want to look like a cat. Okay, that's a different discussion. Then we have to sit and talk about different things. But yeah, no, it is out there, interestingly enough. And some of it might look good, actually, but it's not for everyone, for sure.
Okay. So how do you help these types of patients separate the filters or whatever they're seeing on social media, right? Fantasy from having a safe, realistic outcome? How do you do that?
The more I get older, the more I learn to listen first. So I listen to them. I understand exactly where they're coming from. And then I tell them, okay, these are the facts, right? I've been doing this for 20 years, and these are the facts I learned in 20 years. 1, 2, 3, 4, 5, 6. And this is medical, and there are things that have opinions. There are things that have no opinions. It's just a fact. And my job is to give you the options and the facts, and you end up choosing. So you have to make them a partner into this, because at the end of the day, we are professionals, right? We are the experts, supposed to be, But at the same time, it's their body, it's their decision making, and they have to being informed to choose the right thing to do. And I think if we do that, then you have the right partnership. At any point, if we feel that this is not working or they still asking for something that's not realistic, I think the surgeon should say, maybe it's not the right time to do it. Maybe you should talk more about that. I'm not the right physician for you, things like that.
Okay. How do you collaborate with other doctors like myself, with endocrinologists who are caring for women? And perhaps they're also having discussions, their patients are asking about breast reduction or augmentation or perhaps the mommy makeover. How do you collaborate with their doctors?
I love it when there is another physician on board, and we got a lot of referrals actually from other physicians. And basically they're coming for us as the surgeon, right? And I want the medical part to be completely managed by that other physician. And we always have conversations together to make sure it's the right timing for them, the right labs, the right medical status, medications, and so forth. So I actually love it. When someone doesn't have a primary care or another caring physician, now I know that I have to play that role, which I don't want to play, but I'm not bad. Again, we try to plan it as much as possible. Yeah.
In that same vein, since you serve as a PCP for some patients who don't have it, what role do you think nutrition, sleep, stress, inflammation plays in the surgical outcomes of your patients and their recovery process?
Definitely in the last 5 years, I appreciated more all these factors. I appreciated more the sleep part, especially me now. Now I need more sleep than I used to.
Yeah.
Because I don't sleep as much and understand that. But then nutrition is very important. I spend a little bit of time now talking about their family situations, the kind of support they have at home. What is their schedule like? What do they do? Do they drink a lot? Of course, smokers is a totally different story. That has to be taken out of the picture as much as possible. But I think you must include that into the equation because the healing really depends on all of these factors. And we had people who had delayed healing just because they were nutritionally deficient. And you got to realize this from the beginning. A lot of labs can show that, obviously, but not all of them. Some of them, you might have good labs and you still have issues with healing.
Yeah, of course. If you had to debunk the biggest misconception about plastic surgery, what would it be?
One is that plastic surgery is going to make you look like someone else, like a famous person or an actor, which is totally not. I think it comes more with noses, with rhinoplasties, and people, oh, I want to have this actor's nose or something. And that's not going to happen because you have a totally different anatomy and in the way it is. The other factor is when people do liposuction, some people think that fat will come in a different area if you do lipo. And I tell them it depends on how much weight loss or gain you do. If you do liposuction and then you end up gaining 20 pounds, guess what? You're going to gain weight in certain areas, and it might go to different areas before it comes to the area that you did the lipo.
Okay.
There are conceptions about facial aging and that at the end of the day, you can do one surgery and then you look young for the rest of your life. And I said, that would be great, but doesn't work this way. We continue to age, unfortunately.
No, that is definitely one thing that we cannot change, at least now. So what trend, and it can be on social media or just something related to something that you're seeing, what trend do you think is overrated?
I think there's a recent talks about Botox and fillers with some disapproval of them.
Okay.
I honestly think that they have the role, and I think the problem happens from overusing them. So I use Botox in a lot of patients. I think it has its function as long as you inject it correctly and in the right dosage. I think fillers are nice, but at the same time, don't inject 7 syringes of fillers in a patient and then they look artificial. And I think that's what sometimes comes back and make an issue about a product is if it's not used properly or excessively, then it will create a different hype. So again, back to natural, back to normal things, safe, obviously, very important.
What innovations are you seeing within plastic surgery that we may not know about that you're really excited about? I can talk about 10 different things within internal medicine, women's health that I'm seeing. So I just wanted to hear about what things that you're really excited about that may be coming out in the near future.
I think fat grafting is just one of these fascinating things that we are learning more and more about. And I did it 20 years ago, and now I'm doing it again, and I'm doing it in a different way. And then even the use of fat is different. So using microfat versus nanofat, which is the very small particles, So I use nanofat for skin rejuvenation by microneedling it. And I use microfat as structural to give some volume and support. And I think we're going to see more innovation of this. Europe has a little bit more advanced in this because they allow them to change the quality of the fat grafting by adding certain products. This is not allowed in the US. We can only mechanically do that. And I think once this gets FDA approval, I think that will enhance our usage of fat grafting for sure.
Is that done to the face or to certain parts of the body? Where is that used?
Mostly face, but
Okay.
you can use it on the breast. You can use it on the hands. You can use it in many body parts, but obviously the facial use is very important. Another thing is becoming how to do, me and you, for example, are very busy. If we need to do facial rejuvenation, maybe we don't have time to do a full face and neck lift, but we still want to look younger somehow. So what could happen is a little bit of a minimally invasive techniques where you combine certain products together. You combine a little bit of microfat grafting, you combine a little bit of liposuction, and then you do some sort of mini lifting to get some results. This is one end of the story. The second end of the story would be a more structural face and neck deep plane facelift. So it's interesting. There's two extremes, and both of them have places in my mind in the right patient. And I always ask my patient, are you trying to have the best result, or you don't have time and you're trying to have some quick result with some improvement, but not the full improvement? And that's a very important question to ask. And if they choose the first one, the simple one, I tell them, don't expect the simple one to give you the result of a deep plane facelift. It's just not
Okay.
good. Yeah.
Okay. Yeah, you give them the clear answer so that there's no disappointment. As a physician, not as a surgeon, but as a physician, what does to you?
Aging well now, and even using it on myself, means one, exercising, staying active. Number two, sleeping. You brought in sleep, and more, I really respect sleep. Eating well, there's no question about it. Maintaining positive social interactions. And this is not just your immediate family. It's actually the extended relationships. It's these friends from college and school and things like that. The community, the being in a community makes a big difference in aging in my mind. And then more specifically, obviously, maintaining your skeletal muscle mass, maintaining your bones, especially for females postmenopausal, maintaining your peace inside, which is very hard with all the stressful life we all, carry every day. But I think more and more we just have to look inside and see what makes us happy and why we're doing what we're doing, right?
I've asked you many questions, Doctor.
I love it.
Today, is there something that I haven't asked you about that you are passionate about and wanted to speak about?
I think we talked about facial aesthetics, which I love. I think, as I said, the entry to the face and the soul is eyes and neck. And that's what happens a lot. We do a lot of eye surgery. I think it's the most simple thing to do. It could be done under local. So that really helps. One thing I just wanted to mention also about breast cancer is the advances made in breast cancer reconstruction over the last 40 years is just incredible.
Yes.
And when I give talks, I have a slide from the 1970s breast cancer to the 2020s. And I tell people, these are just two extremes. This is 100 years of innovation, basically. And we're very proud to have seen this in our lifetime. So
yes, absolutely. You can see the difference in terms of reconstruction and obviously the breast surgery itself. So if listeners had to take one message away from today's podcast, what would it be about?
If you decide to do facial rejuvenation or any sort of plastic surgery, do your research. Don't take the information from social media. It's a good starting point, but then go to a professional, go to a board certified specialist, right? In whatever they do, plastics, facial aesthetics, so forth, and get some information, check backgrounds, look for natural results, stay safe, and just have a good philosophy on what makes you happy. Don't do surgery for someone else. You're doing it for yourself. I think that's in my mind the best results and the most successful I've seen.
And what are good resources that patients can use to find plastic surgeons such as yourself?
I think definitely the bigger societies, the American Society of Plastic Surgeons, the Aesthetic Society is our main foundations in the US for board certified plastic surgeons. They're welcome to go to my website, drseifi.com. There's a lot of information. We even have chats and people talking to them with complimentary advice. It's always a good thing to do that.
And if my patients were to look for you, for your website, to find you on social media, where would they go to?
So drseifi.com would be the website. Instagram is newportplastic_Dr. H. Seify. But I think if they put Dr. Seify, they're going to find it. There's not a lot of Seifys around.
This was great.